So my name is Anthony Jones, and one of my concerns is if there's such a concern about these different versions of COVID-19, why aren't we doing mass vaccinations from similar to what we're doing with polio and measles? Why haven't we taken it to that level? What are we waiting for?
It's a good question. I think, and thank you for it. I think I would say though we have done the mass vaccination part of that question that I'm hearing, because not only did kind of states jump into action, and so the state governments, the county governments, but the federal government jumped in action as well. And in the federal government's part, in actually removing a lot of the barriers, a lot of the red tape that's often in the way of getting things done was removed for the development of the vaccine. And then once it was developed, kind of streamline the process for it to be evaluated, and then eventually approved for use. And then kind of making sure it was distributed to all the places without much of a barrier for us to receive them. And then a lot of us, NorthPoint included, have really kind of shut down certain operations and really kind of focused a lot of our efforts. In the beginning, we were testing, and now we're vaccinating. So, big push, a lot of staff, a lot of investment of time, and to really reach out to as many in the community as we could with the vaccination. I think though what I'm hearing a bit in that question is the question around mandates or requirements. And I think if we look kind of in the news recently, you're seeing a lot more kind of private organizations or private businesses, a lot of state governments. The federal government announced yesterday or today that civilian employees will be required to be vaccinated, or get some regular amount of testing. So I think people are moving in the direction of, encouraging people or making it more mandatory to be vaccinated, but leaving an option if you still have a conscientious objection to being vaccinated, that you would then be tested with some regularity to make sure that everyone is safe. So I do think, that we are moving in that direction. I also think we have kind of done a lot up to this point in the efforts to get people vaccinated. And, just for some perspective, most of us who went to public school had required immunizations. And if you're if you're a veteran or you join the military, there are required immunizations. Those of us who work at NorthPoint have required immunizations if you work directly with patients. So kind of measles vaccinations and those is to evidence that you have been vaccinated or are immune to them. So it's not a foreign concept. It's just that we don't often kind of think of it in that perspective, that most of us have already taken required immunizations or vaccinations at this point.